guys, this is your tita in China, and today we're back with a new skincare video. Today we're going to talk about the first 12 weeks of your retinoid use, what to expect, and how to cope with the adjustment or the changes that is happening within your skin. But before we move on, as usual, if you're new here, welcome. Happy to have you on board. My name is Emmeline and I am your tita in China. I upload skincare related videos as well as China related videos. So if any of this is interesting to you, don't forget to subscribe to the channel and hit the bell so that you will know the next time I will upload a new video. So as I've said in my previous videos, I actually have two. I'm going to link the most recent one up here because this video again is going to make more sense if you have watched the last video. So anyway, as I've said in my last videos, the gold standard for skincare really is retinoids. However, I did say that retinoids also require a lot of time because the adjustment period needs to be really slow and gradual so that you will not suffer what is called a retinol burn. And as the name suggests, it really feels like a burn. Your face feels like it's on fire and you're going to really suffer. More importantly, it's going to hinder your progress for at least a couple of weeks before your skin actually goes back to normal. So do not underestimate how low and slow you take retinoids. The slower and the more gradual, the better. The whole process of your skin getting used to retinoids is actually called the retinization phase. And this can be anywhere between 3 months to 6 months or even a year. You know, one thing I realized that people never tell you before you start a retinoid is the fact that when you are getting used to a retinoid, you really don't need any other skincare product. So my first advice to you is start a retinoid when you already used up all of your other skincare products. Because you really won't need a niacinamide, you really won't need your salicylic acid or whatever else you might have in your skincare routine. The only thing that you really need during the first 12 weeks, especially of retinoids, would be a gentle cleanser and a gentle moisturizer and sunscreen. Everything else you don't really need. And sometimes you do sabotage your progress because you feel sorry for all of the skincare products that you have left there that you can't use, and it's money wasted and you feel sorry, and then you end up using it just so they don't go to waste, and you get an irritation. You add irritation on top of the retinization phase and you sabotage your progress. So use up all of your products. Don't leave any products behind before you start using your retinoid, or you can just donate your other skincare products. Do not leave your products in sight because really you will be tempted to use them because you don't want them to go to waste. Also, if you have acne, wait until your acne is clear. I mean, you don't have to have perfect skin before you start a retinoid, obviously, but wait until you don't have any active pimples anymore, because you shouldn't be putting retinoids or pretty much anything on open, weeping, or active acne because it can make it worse. Especially if this is your first time trying a retinoid, you don't actually know how sensitive your skin is going to be to retinoids, so it's best to just assume that you're going to be really sensitive to retinoid and go slow, and also be very mindful. So we already talked about the things that you should consider when choosing your first retinoid, but personally, I would suggest going for the lowest dose you can find and just using it once a week for the first couple of weeks so that you can see how your skin reacts to the retinoid. So if you're starting with a retinol, if you have chosen retinol, then you can go for as low as 0.3% or even 0.2% if I'm not mistaken. Or if you're going to retinoid, which is what I personally recommend, you find the lowest retinoid that you can find. Retin-a, I think, has a 0.01 or a 0.025. You can also just use any other brands as long as it is a low concentration. Basically, just find the lowest concentration you can find and get a small tube. You're only really dipping your toe into the pool here, so there's no need to splurge and buy a big tube. Just get a small tube because that's going to last you a couple of months at least if you're only using it once a week or twice a week. You will also feel less sorry throwing a small tube away or giving a small tube away, especially if you realize after a couple of weeks that it's too weak for you and you need to kick it up a notch. Start with once a week and only about a half pea size or a whole pea size amount. And half pea size is if you have a small face. If you have a bigger face, then it's 1 pea size amount, but don't go beyond 1 pea size. Now, you're going to ask me, but it's too small. It's not going to be enough to cover my entire face. Well, that is where buffering comes in. And buffering simply means that you're putting moisturizer on before you put the retinoid. So the moisturizer is actually going to help you spread the retinoid around more. So the routine will be you wash your face, you remove your makeup, and then follow it up with a serum or a toner if you want. It's not necessary, but if you want, make sure that the toner or the serum are moisturizing toners or humectant toners, not the astringents, not the exfoliating toners, okay? Go with a pH balance, soothing and moisturizing toner or serum, and then put moisturizer on, a thin layer of moisturizer first. And then you put your retinoid on, follow it up with a retinoid, spread it around evenly, and then add another layer of moisturizer. So it's like a sandwich. Moisturizer, retinoid, moisturizer. The 2 layers of moisturizer will actually help you spread the retinoid around more so that you will not be tempted to use more retinoid. So wait for a few days first. For me, definitely, the next morning when I woke up, I definitely feel like the dryness and like a bit of a redness on my skin. So I knew that I had to stick with that dose for a bit longer. But for other people, the drying, flaking, and that stuff actually comes a little bit later. So you give yourself a week and like assess your skin. How does your skin feel like? If within the week you absolutely had no reaction, it's like normal, then you have your second dose of retinoid 1 week after you started. So within that first week, after the first time you use a retinoid, you have to continue with a very basic skincare routine. Again, a moisturizing toner or serum, moisturizer, sunscreen, to make sure that you are helping your skin recover. If there's absolutely no irritation, on the second week, you can try using it twice a week. So for example, if you started on a Sunday, the next Sunday, you have your second application, and then maybe on Wednesday or Thursday, you have your third application. And as usual, in between, just use moisturizing products. Make sure that you are helping your skin recover and not drying it out too much. If by the second week, you still don't see any irritation, any flaking at all, then by the third week, you can continue on using it 3 or 4 times a week or every other night. But this is only when there is absolutely no irritation, like you're not feeling anything different at all. Personally, I stayed on the once a week for about a month, about 4 weeks, before I actually moved on to 2 times a week. But of course, there are others who will progress much quicker than me, and there are others who will progress up to maybe 3 times a week and then stay there because they are seeing a little bit more dryness, a little bit more flaking at that frequency. A lot of tretinoin and retinol users usually would limit to about 3 to 4 times a week. So every other day or every 2 days or 2 nights. That is usually where they feel like the tretinoin or the retinol is working. So if that's a situation for you, just keep at it. There's no pressure to move up to every night. Remember, you only increase the frequency or the number of nights that you use retinoids if there's absolutely no irritation, no redness, no flaking whatsoever. It might take you 3 months to actually move up to 4 times a week. It may take you 6 months. That's not a problem. Don't fall into that trap where you feel like you need to feel a pain or you need to feel discomfort with your retinoid use to know that it's working. The goal is to introduce retinoid into your skincare routine and not have any painful side effects. You might not be seeing the effect of it on the outside yet, but that's definitely already starting to work in the deeper layers of your skin. Okay, so the time that you're starting a retinoid is also not the time for you to be starting on other skincare products. If you're switching some of your skincare products to fragrance-free and essential oil-free, pH balanced, moisturizing products, then that's fine. If you are using a retinoid and you want to try, like say, an exfoliating acid or like an essential oil serum, now is not the time, because retinoids can definitely cause sensitivity and irritation in your skin. Now is not the time for you to try something that might cause more irritation to your skin, and that includes things like vitamin C or glycolic acid, stuff like that, especially during the first 3 months of retinoid use. Now, speaking of essential oils and fragrances, I am a little bit uncomfortable saying that you should give them up. I really do think that especially during this time, during starting retinol, that it's going to help you a lot if you are going to stop using essential oils and fragrances in your skincare routine. But the reason why I'm a little bit not confident saying that is because if you have not experienced any reactions in the past towards fragrances or essential oils, I really don't think that you have to switch to fragrance-free and essential oil-free. So I guess it's more fair to say you use products that you are used to and you use products that you know work for your skin, especially when you are starting retinoids. So don't overload your skin at this time. If you're going to use a toner, use a toner, but make sure it's moisturizing. If you're going to use a serum because you feel like you need something heavier, then use that. You don't have to use both. You don't have to layer too much. You don't need to have 4 different ceramide creams. 1 ceramide cream or 1 moisturizer or 1 moisturizer with colloidal oats is already fine. You don't need to layer too much. Don't overload your skin. It is right now undergoing a lot of stress, a lot of adjustment because you introduce retinoids. Just leave it to do its thing. Don't overload it. The next thing to remember is sunscreen. Now, the time that you start a retinoid is not the time for you to be lazy and slacking off with your sunscreen and your sunscreen reapplication, okay? It will also help if you use UV protective clothing, like, a hat, sunglasses, a visor. These days, especially with the situation now, having a UV visor like this one here, using a UV visor instead of a face shield might actually just work so that you can give additional protection to your skin, especially because retinoids can make your skin more sensitive to the sun, and also because we are working so hard for that skin rejuvenation. We're working so hard to push that dead skin cells away and for baby skin cells to come out. So why do you want to damage something that you have worked so hard to get, right? And if you do get a retinoid irritation, protecting it from the sun actually will help it heal faster because the sun does cause inflammation as well. So, your skin is already inflamed from the retinoids, irritated, plus irritation from the sun. It's not a good combination. So because one of the effects of retinoids is to make your skin turn over faster, then the effects will also be visible to you as your skin turns over. Depending on your age, it can actually take up to 90 days. But with retinoids, it can be as little as 6 to 8 weeks. So about a month and a half to 2 months. But of course, the rate of skin cell turnover will depend on how high the concentration of retinol you are using right now. Since I recommended you to use a lower concentration, expect the results to be at around the 8th to the 12th week mark. But of course, you will already see changes by the 8th week, by the 2nd month. But it's really going to become more visible and even other people will start noticing it probably around by the 12th week, which is really where your retinol adjustment period peaks. So if by the 8th week mark, you have already completely adjusted to your current dose, you can now go up to a higher dose, maybe to a 0.5 if you have started with a 0.025. But again, when you double your dose, make sure that you start again with 1 to 2 times a week only. If by the 8th or the 12th week, you don't want to go a step higher, you want to, stay at the same dose or same concentration, same frequency, you can now start adding things like exfoliating acids like BHAs and AHAs into your skincare routine. But as always, go gently and just go by what your skin feels like that day. The first 12 weeks really are the most difficult time or the most difficult adjustment period for retinoid use. It's not difficult, it's not climbing Everest or anything like that. But it really does take a lot of patience, a lot of change in your mindset, especially if you're the type of person who's used to layering a lot of different products. Sometimes if you're just going down to basics, it feels like you're not doing enough. But trust me, you are. Really, it will pay off if you're going to, and I've said this a million times before, it will pay off with retinoids if you're going to start low and slow. Now, 12 weeks is also about the time where people would get what is called the dreaded purge. A few clarifications about the purge. I've already explained this in my purging versus breakout video. It's right here. Purge is not something that you need to be scared about. This is what happens, okay? So your retinoid starts working and it's pushing out clogged pores, it's pushing out your baby pimples, and it's starting to normalize your skin, right? But remember, if you're the type of person who doesn't really get pimples at all, then you will not get a purge. If you're the type of person who will get maybe 1 or 2 pimples around the time of the month, then that's most likely all that you're going to get during the purge. And if you're the type of person who really has like mild to moderate acne, you will get maybe more pimples than usual, but it's really nothing that you haven't had before. So the purge really is a very manageable situation, but especially for people who have had acne before. And remember, I told you to start when you don't have any active pimples, when all of your pimples have healed. There is like a psychological effect. When you started off with a clean face with no active acne, then all of a sudden, a few weeks later when you started this product, you're starting to get all of these pimples. There's a psychological effect there that makes you think that it's the retinoid that's causing all of your pimples. That's simply not the fact. Also, on top of that, your acne tends to heal faster and heal cleaner, without a scar if you are on a retinoid. So during that purge, just remember that this is part of the process and it shouldn't go on for a long time. Your purge probably should last only a week or 2. It shouldn't last longer than that. Okay, so during that time when you are getting more pimples, what you need to remember is to make sure that you take care of your pimples, get them extracted professionally if you can, but also spot treatments work really well. So you take care of your pimples, make sure that they don't get infected, make sure that you don't mess around with them and create deeper scars. Just let them be. The retinoid is doing its job and it's going to go away soon enough. It's going to pay off, but just like all good things, you need to wait, you need to be patient. You will not regret using tretinoin. And there's really a reason, there's a legitimate reason why this is called the gold standard in skincare. Next week is the last video for Retinoids month, and we're going to talk about tips and tricks and little advice that I can give you about common retinoid issues. But for today, that's our video, and I hope that you found this video informative and I hope that you found it helpful. If you did, please give me a thumbs up and share this to your friends who are also skincare buffs. If you have comments, questions, suggestions, violent reactions, put them in the comments down below. Let's have a conversation. Thank you for watching, guys. See you next time. Bye! 下次见。